This medication is used to treat certain eye conditions caused by inflammation or injury. Prednisolone works by relieving symptoms such as swelling, redness, and itching. It belongs to a class of drugs known as corticosteroids. It is important to follow your doctor's instructions for the correct dosage and timing of this medication. Typically, it is recommended to use 1 to 2 drops in the affected eyes every 1 to 2 hours during the day for the first 24 to 48 hours. After that, the dosage may be decreased to 1 to 2 drops every 4 hours. It is best to use this medication at the same times each day to help maintain a consistent level in the body. When using Forte suspension, drops, it's important to follow your doctor's instructions. If you wear contact lenses, do not wear them while using this medication unless your doctor says it's okay. If your doctor approves, remove your lenses before using the eye drops, and wait at least 15 minutes after applying the drops before putting your lenses back in. To apply the eye drops, wash your hands and shake the bottle if it's a suspension form. Tilt your head back, look upward, and pull down your lower eyelid to create a pouch. Place 1 drop into the pouch, then close your eyes for 1 to 2 minutes. If you need to use the drops in both eyes, repeat the process for the other eye. Use the medication regularly at the same time each day to get the most benefit. Your doctor will determine the dosage and how long you should use the medication. Do not use it more often or for longer than prescribed, as this can increase your risk of side effects. If the medication becomes contaminated, do not use it. Using contaminated eye medication can cause infection and damage to the eye. Contact your doctor if your condition does not improve after 2 days or if it gets worse. Occasionally, you may feel a slight stinging or burning in your eyes for a short period of time after using this medication. If these sensations persist or worsen, it's important to let your doctor or pharmacist know. It's important to keep in mind that this medication has been prescribed to you because your doctor believes that the benefits outweigh the potential risks of side effects. Most people who use this medication do not experience any serious side effects. However, using this medication for a long time or in high doses could lead to serious eye problems, such as increased pressure inside the eyes and cataracts. If you experience any vision problems or eye pain, it's crucial to inform your doctor immediately. This medication may also hide the signs of an eye infection or increase your risk of developing one, especially with prolonged use. If you notice any new or worsening symptoms like eye discharge, swelling, redness, vision problems, or no improvement in your current eye condition, you should contact your doctor. They may need to adjust your treatment. It's important to report any serious side effects, such as headaches or dizziness, to your doctor right away. Although rare, a severe allergic reaction to this drug is possible. Seek medical help immediately if you experience symptoms like rash, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects, be sure to contact your doctor or pharmacist. And remember, if you're in the US, you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before using Forte suspension, drops, make sure to inform your doctor or pharmacist about any allergies you may have, including allergies to sulfites which may be present in some brands of this product. Also, let your doctor or pharmacist know about your medical history, especially if you have had eye infections, eye surgery, cataracts, open-angle glaucoma, severe nearsightedness, or diabetes. After applying this medication, your vision may become temporarily blurred or unstable. It's important not to drive or operate machinery until your vision has cleared. If you are planning to have surgery, make sure to inform your doctor or dentist about all the medications you are currently using, including prescription drugs, non-prescription drugs, and herbal products. If you develop a new eye infection or injury, or if you need eye surgery, consult your doctor about whether you should continue using your current bottle of Forte eye drops or start a new bottle. If you are pregnant, only use this medication when clearly needed and discuss the risks and benefits with your doctor. It is not known whether this medication passes into breast milk, so consult your doctor before breastfeeding. It's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Remember to always consult with your doctor before starting, stopping, or changing the dosage of any medicines. If someone accidentally swallows Forte suspension or drops, it can be harmful. If they have serious symptoms such as passing out or trouble breathing, it's important to call 911 immediately. Otherwise, contact a poison control center right away. In the US, you can call 1-800-222-1222 for your local poison control center, and in Canada, you can call a provincial poison control center. It's important to keep this medication out of reach of children to prevent accidental ingestion. Do not give this medication to anyone else. This medication has been prescribed specifically for your current eye condition. Do not use it for another eye condition unless directed by your doctor. A different medication may be needed for that. You may need to have regular eye exams and measurements of the pressure inside your eyes while using this medication. Make sure to keep all your appointments with your doctor and for any medical tests. Be sure to consult your doctor for more information. If you happen to forget a dose, you should take it as soon as you remember. However, if it's almost time for your next dose, it's best to just skip the missed one and take your next dose at the regular scheduled time. It's important not to take a double dose to make up for the missed one. When storing Forte suspension, drops, final dose form, make sure to keep it at room temperature away from light. Different brands may have different storage requirements, so be sure to check the product package or ask your pharmacist for specific instructions. Avoid freezing the medication and always keep the bottle upright and tightly closed when not in use. It's important to keep all medications out of reach of children and pets. When it comes to disposing of Forte, do not flush it down the toilet or pour it into a drain unless you are instructed to do so. Instead, properly discard the product when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on the proper disposal method. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.